Your Excellency, the Secretary to the Government of the Federation, and let me repeat the MC, the man who is a boss from Bath, Mr. Boss Mustafa, the DG NAFDAC, Professor Mudishola Adeyeye, and Chair of a body of academic experts on the Health Sector Research and Development Initiative Scheme, Intervention Scheme, our Deputy Governors here present, other distinguished ladies and gentlemen. I am extremely pleased to be here this afternoon and also to be welcoming you to the award of grants for the Central Bank of Nigeria's Healthcare Sector Research and Development Intervention Scheme. As we are all aware, the outbreak of the coronavirus pandemic has had an unprecedented effect on the global economy. It highlighted the truth which many of us have always known, that a healthy and safe workforce is critical for continued economic growth as well as stability of our financial system. We all witnessed how a public health crisis and emergency brought strong economies, indeed all the economies in the world, both developed and developing nations, to their knees. In Nigeria, it exposed the fragility of our healthcare system and the urgent need to look inwards and build a more robust and sustainable healthcare system in Nigeria. Like you all know, when the pandemic set, different economies locked down, or different governments locked down their economies. Those that could produce food and export locked down their economies and they held back the food that they could export. Those that had even drugs, medications that could help even cure the COVID-19 held back their drugs in their countries because they said that it is important for them to take care of themselves before thinking of an outsider. Unfortunately, we turned out to be outsiders, and of course, but we thank God that the consequences on our economy and on our people is not as grave as many would have expected. What that did is to expose again our fragilities and the need to begin to say that it is time that Nigeria and Nigerians should come back and think about how do we provide for ourselves. We all know, just like education, health care is seen to be the bedrock of development of any nation. Nigeria at the time was moving very fast, but we got to a point today where we are and heavily dependent on other countries. The federal government or Central Bank of Nigeria, working with federal government, have decided that we must begin to look inwards and provide for ourselves. And that was the main reason the CBN set up the body of experts chaired by Professor Adeyeye, a renowned pharmacologist, to chair our Health Sector Research and Development Intervention Scheme initiative. The response by some advanced and developing countries also reflected the significant advancements that have occurred in the health sector in those countries. Their investments in research and development enabled health institutions to develop a rapid response to the coronavirus with the deployment of vaccines in record time. These measures have helped to increase the availability of vaccines in developed countries. On the other side, developing nations have had to contend with limited supply of vaccines for their citizens. It is therefore imperative that we find ways to encourage research and innovation in the treatment of health conditions for our citizens in Nigeria. As you may be aware, the Health Sector Research and Development Intervention Scheme was introduced with the release of implementation guidelines and subsequent inauguration of the scheme's body of experts in July 2020, chaired by Professor Adeyeye. The scheme, which was part of CBN's policy response to the coronavirus pandemic, aimed at prompting intense research and development activities towards developing vaccines and drugs against the spread of other communicable and non-communicable diseases in our country. Under the Health Sector Research and Development Intervention Scheme, grants are provided to researchers and healthcare institutions for the development of vaccines, drugs, and herbal medicines, which could help curtail the spread of not just only COVID, but also any other communicable or non-communicable diseases in Nigeria. Ladies and gentlemen, following the submission of over 286 proposals from the general public, I'd like to express my profound gratitude to the body of experts for finding time out of their very busy schedules to review and evaluate these proposals. So far, 68 proposals have been evaluated, out of which 5 proposals with significant merits valued at 253.454 million naira were recommended by the body of experts for financing. I see this opportunity to congratulate those that are coming as the first batch: Professor Olufemi Emmanuel Babalola, Dr. Koli Ikechukwu, Dr. Garba Ubar, Dr. Ugedengbe, and Dr. Ortega Ejofodomi. Some of the recommended proposals also have the potential to enable the development of the Nigerian vaccine for COVID-19. It is as a result of the remarkable work by the committee that today's grant award ceremony is taking place. I'd like to congratulate the recipients again of this award for their efforts in working to develop solutions to some of our healthcare challenges, and I'm also pleased that most of our recipients are from the academia, a sector that had lacked funding for research and development. I see this opportunity. The CBN has just taken one leap. I see this opportunity to appeal, not just to, because no doubt we have problems of dearth of funding, but I see this opportunity to appeal to our corporate institutions. You are in medicine, you are in engineering, you are in any area in the sector. You should come together and work with us to develop and fund research and development for the good of our people. We need to encourage our brothers and sisters in the academia so that they can, rather than take flight abroad, they can stay back at home and go straight into research that will help our people. Let me reiterate that the review of proposals is still ongoing, and we expect the committee to provide recommendations for additional award of grants in due course. Ladies and gentlemen, today's grant award is a testimony to the significant role research and development in healthcare could play in supporting economic growth, and particularly as growth is highly dependent on a strong and healthy workforce. Meeting our need for a strong and healthy workforce with better safety profiles is a task that can only be addressed through a healthcare sector that provides for significant investments in research and development. A vibrant and innovative healthcare system is also vital for our national security. We all witnessed how a number of countries and territories adopted stringent and the immediate export restrictions on critical medical supplies and drugs that were specifically meant to help countries respond to the spread of this virus. The CBN has over time emphasized the need for us to move from a consumer-based economy to a more productive-based economy. To this, the bank has developed intervention programs and schemes across various sectors, including the healthcare sector. As part of proactive measures to support the growth of healthcare sector in Nigeria, the CBN introduced the Healthcare Sector Intervention Facility, which is still not fully disbursed today. The facility is aimed at strengthening the sector's capacity to meet the increasing demand for healthcare and products and services, particularly pharmaceutical companies and other healthcare value chain players intending to build or expand capacity. Currently, 82 projects valued at 85.89 billion naira have been financed through this scheme. The projects financed comprise 26 pharmaceutical and 56 medical projects across our country. At this juncture, ladies and gentlemen, I'd like to urge the recipients of these awards to judiciously utilize the opportunity afforded them by the CBN and strive to achieve the purpose for their research by ensuring that their projects meet the set targets, aims, and objectives of supporting the development of vaccines and drugs in Nigeria. Let me say that everybody will focus on you. They'll be following you, the award recipients, to know how far you have gone in actualizing your research proposals. And I want to wish you well. And because you are just about, I'll say you are the first set of people that are coming on, it is important that you set a pace that others can follow. And please utilize these funds judiciously. They may look small, but at least we begin a journey today. It is my strong belief that this will offer the average Nigerian access to much needed vaccines and drugs for not just COVID-19, but other communicable or non-communicable diseases. Distinguished ladies and gentlemen, let me conclude by reiterating that the CBN is committed to the successful implementation of this scheme. Hence, we will ensure the review of and evaluation of subsequent applications. In closing, I thank Mr. Boss Mustafa, the Secretary to the Government of the Federation, for the support that he has given, for the hard work he has put in throughout this period as chairman of the Presidential Task Force on COVID-19. We thank you and pray that you don't relent in this task. Thank you so much for your attention.